Good evening, everyone. Thank you for joining us for the MSF Career Focus Briefing Series. My name is Ji-hyun Bang, and I'm with the MSF Career Communication team. Just a quick reminder before we begin, we have simultaneous interpretation going on in the background in both Korean and English, so please choose your preferred language if you need that translation. Médecins Sans Frontières, or MSF, is an international medical humanitarian organization. We respond to crises around the world, whether it's conflict zones, outbreaks of diseases, and natural disasters. You'll be hearing the term MSF throughout the session. It stands for Médecins Sans Frontières, which is French for Doctors Without Borders. The Focus webinar series aims to shed light on emergencies that are happening right now or those that may have been forgotten, and to give you a closer look at MSF response efforts on the ground. Today is our 11th focus briefing, and we'll be turning our attention to the devastating earthquake in Myanmar, which struck 2 months ago. So on March 28, 2025, a powerful magnitude 7.7 earthquake hit central Myanmar, affecting regions including Mandalay, Naypyidaw, Sagaing, and southern Shan State. The disaster left over 3,800 people dead, with more than 5,000 injured. Hospitals, roads, water, and sanitation systems, and most of the infrastructure suffered serious damage, and over 1,700 people are still living in extremely vulnerable conditions. To help us understand what's happening on the ground, we are joined today by Jesah Pontevedra, who arrived in Myanmar on April 1st, just days after the quake. She's the emergency medical coordinator. We'll begin with Jesah's update from the field, and then we'll move on to Q&A session. If you have any questions, please feel free to drop them in the Q&A tab at the bottom of your screen. And let's now begin Jesah's presentation.
Thank you very much for that. Good day. So my name is Jesah. I'm a medical coordinator, and I arrived in Myanmar on day 2, essentially, after the earthquake. Next slide, please. So as has been explained already, on March 28, a very strong earthquake hit the northern side, the central and the northern side of Myanmar. After that, a 6.2 magnitude aftershock followed. The epicenter was really in a place called Sagaing, with a 10-kilometer depth. And tremors were felt from all the way in Thailand, Bangladesh, China, and Laos. When we arrived, we saw widespread destruction of different infrastructures and buildings. And then there were so many people displaced, about 207,000. This is already on top of a displacement that's been happening in Myanmar because of its current context as well. And approximately 3,800 up to 5,000 people were killed because of this earthquake. 193 health centers. This is a combination of small health centers as well as big hospitals were destroyed because of the location of the epicenter of this earthquake. A lot of referral, or what we call tertiary hospitals, or the bigger hospitals in Myanmar, were the ones that were most impacted. The specialist hospitals were the ones that were most impacted. I spent around 2 weeks in Myanmar, and even after I left, aftershocks up to now are still continuously being recorded, increasing the risks to the affected population. Next slide, please. Now, this just shows some of the destructions that we saw in Myanmar when we arrived. It was quite devastating. You see block after block of quite destroyed infrastructure. Next slide, please. Now, MSF, we have been in Myanmar for a long time because there's also other needs in Myanmar, not just because of the earthquake. So in Myanmar, we have a lot of projects in the southern part of Myanmar, in the western part of Myanmar, as well as in the eastern part of Myanmar. We all know there's the population movement from the Rohingya population, as well as population movement from other ethnic tribes of Myanmar into its neighboring countries. So MSF, we've been there for a while, giving different medical services. Now, straight after the earthquake, we did quite a few activities. So we had mental health, wherein we trained 200 plus volunteers. There's a combination of professors, teachers, medics, students, and how to deliver psychological first aid. And then soon after, we transitioned that psychological first aid into ongoing small group sessions, as well as one-on-one counseling and child-focused activities to continuously address the mental health needs of the population impacted most by the earthquake. We also did quite a bit of hospital logistics support in the different damaged facilities, wherein we provided tents because at that time, because of the different impacted infrastructure were hospitals, health centers, a lot of the patients had no safe space essentially to receive medical care. So we donated tents as well as different medical equipment like hospital beds as hospital support. We also did quite a bit of water and sanitation, installing latrines, hand washing stations, water systems, as well as restoring boreholes and electricity in different damaged hospitals. Next slide, please. Of course, we did quite a bit of medical care because access to healthcare was quite impacted. So then we deployed mobile clinics in 14 plus locations in Mandalay, Sagaing, as well as in Ley Lake, treating acute and chronic conditions. Why? Because what happened was that, again, because healthcare was severely impacted, a lot of people with chronic conditions were unable to get their regular medications, their usual follow-ups with their healthcare professionals. So then our mobile clinics ensure that access to this healthcare is still with the population. And then we also did quite a bit of health promotion, community education and hygiene, as well as disease prevention, because with the crumbling of the different infrastructure, not just healthcare infrastructure, but also public health infrastructure like water sources, sanitation infrastructure, then the risk for outbreaks is really increased. So it was very, very important to do early risk communication or health promotion. And then, of course, at the very beginning, we also did quite a bit of relief distribution, wherein we delivered 2,070 non-food items. That includes hygiene kits, dignity kits, as well as shelter materials, and 1,900 mosquito nets across the different areas. Next slide, please. So these are some of the different activities that we've done. So from delivery of different non-food items to restoration of boreholes for the population to be able to access safe drinking water, as well as safe space for children and activities for children to address the mental health needs, and the different mobile health clinics that we did in these different locations in response to the earthquake. Next slide, please. So normally, MSF, Médecins Sans Frontières, Doctors Without Borders, people would always say, but you only do medical care. No, in fact, we don't. We do any and every emergency response, emergency activities that we can to be able to restore dignity, as well as preserve health and wellness of the population. So in Myanmar, for example, we didn't just do mobile clinics, as I've mentioned, but we also did a lot of provision of safe drinking water by restoring boreholes. There was the distribution of shelter materials so that then the population can restart building their shelters, because of course we also had to to be aware of the fact that the rainy season or the monsoon season was coming, with a lot of displaced population, homeless people. And then infrastructure damage, public health infrastructure damage, it really increases the vulnerabilities of the population to having, outbreaks like cholera, malaria, dengue. So these are still some of the activities that we did in Myanmar in response to the earthquake. Next slide, please. And finally, now it's been more than 2 months after the earthquake, but really the needs still persist. Water, sanitation, and hygiene. As I mentioned, safe drinking water, it still remains scarce. The damaged system, it's really quite vast. And then the rain has started. Even before I left, the rain already started. So this really increases the risk for cholera, malaria, and dengue. Shelter, the makeshift housing is really not enough, especially with the monsoon season that's coming. And then, of course, healthcare access. The recovery period in Myanmar is going to take long. Not just the hard infrastructure, the buildings, also the power, that infrastructure, it causes shortages, which limits access to healthcare as well. Now, because of these damages to these important infrastructure, hospitals, healthcare facilities are unable to perform essential procedures. Medical supplies are also starting to see some shortages, so this means that even though Myanmar does have available trained health personnel, without the proper tools, without the stocks, then there's only so far that they can go in being able to provide access to healthcare to the vulnerable population. And finally, protection and mental health is really a persistent need. Again, this is not a need that's just going to be there, that's just been there now. This is a need that's been there for a while, and it's become even more, or it's compounded because of the impact of the earthquake. Family separation, there's the SGBV risk with the lack of safe spaces for women and children, and men as well, that is at risk for SGBV. And of course, the psychological stress and the stress that earthquake, continued aftershocks, the displacement brings to the different communities, vulnerable communities. So it's been more than 2 months, but these needs still persist in Myanmar. Next slide, please. And that's it. It's a very short presentation, but please feel free if you have any questions.
Thank you, Jesah, for taking us through the entire landscape of the Myanmar situation. We have a few very detailed questions, so let's just go through them one by one. I understand you're on the emergency response team. As an employee of the MSF, I am also confused. What is the difference between emergency response team and other humanitarian team? So one might think MSF is only focused on medical activities. However, we work on logistics, water, sanitation, and hygiene, etc. So I know that the emergency response team went right into Myanmar, yourself included, April 1st, right after the earthquake started on March 28th. So what would you say is the difference between the emergency response team and other humanitarian teams? I guess that is really when you go in for disaster relief. Can you elaborate more on the activities, how you prioritize, what are the differences in the activities?
Thank you for that. Very good question. So in MSF or any humanitarian organizations, but I can speak only for MSF, we have what we call as our long-term or regular project teams, right? So these are the teams that has been in the country of operations for a long time. And so they are running activities, regular activities, and providing services to the population of that country. So in Myanmar, for example, we have a few teams that's been in Myanmar for a long time already. They have projects or they're providing medical care in different locations in the southern part of Myanmar called Dawei, for example, in Yangon as well. So these are long-term or regular humanitarian teams for MSF. Now, the emergency team, each and every different projects or missions that we have in MSF, we have emergency preparedness plan, right? Because the different locations that we are in MSF, it's always very unpredictable, the situation. We can never predict. So even if we have long-term projects, regular projects running, there's always that chance that an emergency could happen. So these long-term teams have a plan drawn up, and if they see that their plan and what they can do is a little bit, the situation requires more than what their plan has, then they ask the support of the emergency team. So, and that's where we come in. So we're kind of like the extra hands, if you want to call it that, in the event of catastrophic, big-scale emergencies happening in locations that we are in as MSF already, or locations wherein we are not there as well. And there could be instances wherein a country calls on to MSF to say, hey, we just had this massive emergency happen. Can you come in? That's where the emergency teams like myself go in. And the only difference is that we do our assessment, our decision-making very, very fast. Normally it might take, let's say an assessment might take a week to about a week and a half to be able to come up with a report with the findings of that assessment. For us as emergency team, we normally do our assessment in a span of 4 hours, let's say. And then after that, we come to a very, very rough, quick and dirty, we call it, conclusion. That's always looking at the primary needs of our population. And then we come up with a plan very, very quickly as well, based on multiple experiences as to how to address the needs of the population. So that might be the main difference that I can say.
Thank you for that elaboration. It's been about 2 months since the earthquake happened, and you said that there are still a lot of things in need. For example, electricity, rebuilding hospital buildings. For the MSF working in Myanmar, how many people are working there right now? As far as I know, in our Korean office, we have a construction specialist, an architect. They talked about rebuilding hospital buildings or setting up electricity. We call this water sanitation and hygiene, WASH. So all of those related facilities need to be built. I know that the emergency response team has stopped their projects right now, but what else is needed in the long term?
So there's quite a few people in Myanmar for MSF. It's always been one of our bigger missions, let's say, long term, not just because of the earthquake, but even before that, right? Because there's a lot of different contexts or situations that's happening in Myanmar that requires for MSF to be present there. So I can't really say now how big the team is, but there I do know that it's quite big. There's multiple projects in Dawei, in Metkela up north, in Shan State, in Yangon as well. And that's working with the Ministry of Health, and that's also working independently, of course, and trying to give or provide medical care and as well other services to vulnerable population. And of course, let's not forget that there's also the Rohingya crisis, right? That's very, very much connected to Myanmar. So we also have quite a big activities in the Rakhine State area, right? So that's there. That's a lot. Now, when we talk about the recovery, you're right when you say that the emergency teams are not in Myanmar anymore. But Myanmar is still in its post-earthquake recovery phase, right? What we've seen, the different impact on major infrastructure, it's gonna take, you know, more than a year, more than years to be able to really recover and go back to a baseline that's still questionable at this point, right? Like, what baseline does Myanmar go back to? Does Sagaing, does Mandalay, does Nyapito, Shan State particularly, what baseline do they go back to when their baseline already had quite a lot of humanitarian needs there already as well, right? And it's not really just the infrastructure, it's also, I cannot stress enough the need for mental health, for example. Like mental health in disasters is important because in disasters, you try and go through the different phases, right? You have your relief phase, your rescue, your relief, your recovery phase, and then it will lead through resilience, hopefully. You can't go through all of those phases without all of your needs addressed, including your mental health needs, right? Like it's almost, I wouldn't say impossible, but it's very difficult to reach a recovery phase for a population and develop resilience if one of the different, avenues needs is not being addressed. And mental health, it's been a gap in Myanmar. It's been a gap in many countries, but it's been a gap in Myanmar for a while, and it's further exacerbated by this earthquake. Of course, there's also, like I think I mentioned, the SGPV, protection, safe spaces, and access to healthcare, right? And yes, the public health infrastructure, water and sanitation. This year it's the earthquake. Last year it was actually a cholera outbreak that brought some of the emergency teams into Myanmar, right? And this was before the earthquake. Now, after the earthquake, important public health infrastructure are damaged as well. Rainy season is there. Cholera is still there. They have malaria, they have dengue. You have a population with not enough shelter, not enough clean water to drink, not enough sanitation infrastructure, facilities. There's too many compounding risks here, right? So yeah. And of course, yeah, we try as best as we can to address these different compounding risks and compounding needs. But again, Myanmar is a very complicated context, and there's different ways that we can do as MSF to be able to address the needs of the population, because primarily that's really what's important to us, to be able to be there to safely address population needs. But of course, we also have to adjust ourselves to the different sensitivities of the contexts, particularly in a country like Myanmar. But we do our best.
Yes, thank you. As you mentioned, Myanmar is kind of on the better end of having good medical services. And you said that you have been providing medical services for cholera, malaria, etc. Although the earthquake has impacted and complicated things, I believe MSF is still doing their best to address these medical needs. I know that MSF is providing services worldwide, and all of our audience knows this. There's Gaza, Ukraine, many different areas that need our help. Many humanitarian crises in our world today. One thing I'm always curious about for MSF, especially in times of natural disaster, how do you prioritize? There are conflicts, military conflicts going on, there are natural disasters, you have crises in multiple regions. So when there is a natural disaster, how do you prioritize? And you're working on something in another country, but there's an earthquake in Myanmar, and then you decided to go there. Can you tell us about the prioritization?
That is a very good question, and it's normally a difficult question to answer. And in fact, I can only talk about I can share this literally happened to me. So I'm actually working in a different portfolio, let's say. Like I had multiple kind of jobs on my plate before the earthquake happened. And when the earthquake happened, I had to drop everything or hand over to somebody very, very quickly to be able to jump into Myanmar and help out in Myanmar. Now, the prioritization happens by a very, very quick conversation with our director of operations, with our heads of emergency desks, and the different decision makers. We have via phone call going like, okay, this is what's happening right now. We know that this is also important. The work that you're doing is also important, but at this point, within a time frame, the added value can probably be more in this particular context. So yeah, let's go there, because we can have more added value in the very short time to address these particular needs, right? And then to be able to do that conversation or have that conversation and do that prioritization, we also have different indicators we look at, right? We have access. It's very important for us to have access to the population and vice versa, right? Because it would be very difficult for us to try and enter into a country if in fact there's no access to go in there. There's no safe access. So this one is very, very important. Space, the humanitarian space is very, very important to kind of have a look and ensure. Of course, if the needs of the population, because this is the number one prioritization, right? Basis for prioritization. An emergency, we declare an emergency if the situation is increasing the risk for death or loss of life or increase of suffering of a population. This is when we declare an emergency. So the bigger that population impacted is, the higher that prioritization is. So then we have to balance as well, right? So if we see that the needs are big, but the humanitarian the humanitarian space might not be there. Of course, we negotiate, we do a lot of negotiation to be able to answer, to be able to really address the needs that we've identified. But yeah, to be able to say prioritization, it's number one, population needs and scale, right? And then everything else follows after that. There's also, capacity of the different countries, of all of the different actors that's on the ground as well. It's very, very important. There's a rewriting of the humanitarian space right now that we are seeing with what's happening with the funding cuts and all of these things. So prioritization is important. So it's also important for us to really have a clear look at the different capacities that all of these different countries have, and all of the different actors that's already on the ground that we can leverage. And this helps us, whether it's prioritization of the scale of our activities, the type of activities that we do, or if we go into these countries or not. So yeah, thank you.
Okay, thank you so much. So it seems like a very complicated process, and you said what's the utmost priority. So recently, on top of the decision making that happens in MSF, but I think also when you actually go on the ground, for example, Myanmar, as you know, the conflict's still going on. It's been sustained. And there are many humanitarian organizations on the ground in Myanmar to respond to earthquake. So that's what I understand. So just you probably worked in so many different fields. So on the ground, not just coordinating with the government, but I think there needs to be a coordination or cooperation with other organizations on the ground. So I'm curious how you do that. So for example, there are organizations on the ground, sometimes your project or programs might overlap in order to offer most efficient manner. So how do you coordinate your projects with other organizations? So I always wanted to know about that. Can you explain to me about that?
That's all, like, that's a very good question, and yes, absolutely. Like, I think so as MSF, we come in, like in Myanmar, for example. So the very first intervention that we did was the mental health psychological first aid, and we were able to have quite a large network, a large number of population that we were able to deliver psychological first aid to. Why? Because we went to schools, different local organizations, and we just train them en masse as to how to do psychological first aid so that then they can do it themselves. So how we go about that is we either, if we have a long-term project already in that location, then we're hoping that our project teams, our teams have this network that they have already, and then we tap into these networks in times of emergency, and then we talk to them and what activities they're able to do and what activities they can do and how we can support. Or in some cases as well, and this happened a little bit in Myanmar as well, we tap into personal contacts. We have a big like MSF, we're also an association, right? We're an associative movement, and whether that be like MSF, former MSFers that work in the field, or association members, they all have quite vast networks, and we go by, like, contacting these different networks and then meeting them on the ground, and then trying to map, like, we clearly map the different activities, the different locations that these different organizations are doing these different activities in. And then we talk to them as well one by one, and to seeing, like, okay, do you need support from MSF? or is it what type of working relationship can we have? How can we work together if it's us supporting you, or us working in collaboration, or us going to locations that you're not going to? So yeah, there are multiple ways that we kind of collaborate and partner with these local civil service organizations, local non-government organizations or not-for-profit organizations, or even just like what do you call this, civil movements, you know, because that's also one thing in Myanmar that we saw. There was a lot of community movements, community support coming from the community themselves. Like even the people that were impacted, they gathered like water and distributed water to other affected population. So we kind of like had a conversation with them and went like, okay, what is the extent of how much water can you give? How much can you sustain this? Like, and then they tell us, okay, we can't sustain it for too long. And then we say, okay, let's rehabilitate the borehole then, so that then once the donations stop, there's still some place where the population can find water. And then we also saw quite a bit of doctors themselves, like activating, like doing like clinics from their cars. And then what we did was we kind of put them all together with our mobile clinics and went like, okay, let's all form multiple teams and like go together, and then we can support, and whether that be logistics, more medical supply, or you know, expanding the reach of these local doctors and nurses that just mobilize themselves. So yeah, multiple ways and different ways, really, depending on the capacity that we find on the ground, and yeah, what type of relationship that we can have in collaboration or in partnership or in working together. Thank you.
Thank you so much. I heard about the jewelry museum, how it was transformed into a medical facility, and the infrastructure, the medical infrastructure was torn down. And thanks to the owner of the jewelry museum, you were able to transform it to a medical facility. So you brought all the devices and equipment to the museum and treat patients there. So could you like walk me through it?
So yeah, so it wasn't, so when we got there, in Myanmar, the locations that were impacted, like I said, were like specialist hospital. So these are like secondary, tertiary, referral hospitals, and everything was destroyed. Like the bone hospital, the orthopedic hospital was destroyed, the pediatric hospital was destroyed, the maternity hospital was destroyed, and then there was only so many, like, originally, there were probably more than 15,000 hospital beds in that one location. When we got there, it was probably like 500 beds that were functioning. And then when it comes to operating theaters, that includes for pregnant women, they were probably, before the earthquake, there were probably like more than 20 operating theaters. When we got there, there were like 2 or 3 emergency operating theaters and cars that were functioning. And so we were trying to figure out the best way to kind of support in temporary locations. And then the maternity was one of the biggest worry, because like, even though with like earthquakes, like stressful events, it actually induces labor. It induces like pregnant women to deliver prematurely, and because of stress, you know. So like the maternity hospital was really a worry. And so we were traveling and we were trying to figure out where the maternity hospital was, and then we got to this unopened museum. It's a private building that was meant to be a tourist attraction as a jewelry museum, but it never opened. And so the owner didn't donate it, but agreed for the Ministry of Health to have a temporary maternity hospital here in this jewelry museum. And it worked out because jewelry museums are, I didn't realize it, but they're meant to be clean, and there's tiles, and it's actually like quite good setup to have immediately an operating theater, right? And they already had the staff, and they had the supply that they were able to save from their original hospital, brought into this jewelry museum, and we just helped out in trying to organize it, set it up, and donate a little bit other tents and other infrastructure that they didn't have, and have a regular kind of follow up with them as to what else they needed. But essentially they set themselves up that this big compound that was meant to be a jewelry museum then became a maternity hospital. And they even had it wherein the pregnant women and their husbands or their families were also sleeping inside this compound in tents, and that's where we donated some tents, and then water and all of these things. And then the staff also slept in the same compound, and they cooked, and they provide food for the patients there. It was such a good kind of way to see the mobilization and the partnership of the community, of the private institution, and as well us, and to come in to see where the gaps are and where we can support and help. So yeah, it's very good. Thank you.
So it seemed like a very difficult situation, but you probably witnessed the wonderful solidarity in the dire situation. So coming back to the emergency relief situation, so when the earthquake struck, and I believe like the roads were disrupted, and when we looked at the missing map project, there were many like tabs that was open so they can locate which parts are disrupted. So you need to have roads, but because they are disrupted, I believe those networks and roads were not available for you to distribute aids. So I wonder how you worked around it. So you did mention, like during your presentation, they are chronic patients and they have medicine they have to eat every day. And there are some medical relief items that need to be provided for those who are affected. So these need to be delivered. But we did look at the map, and there were some roads. I believe there were some roads that were blocked even though they're supposed to be a road. So when those kind of things happen, how do you work around it? So could you explain to us about that?
So in Myanmar, I think in the missing maps, I think the roads that were blocked in Myanmar were more for other contexts, the war related to that rather than the earthquake. For the earthquake, though, the main road that was heavily impacted was there's a bridge to go from Mandalay to Sagaing, for example, and this was like the bridge that was being used got destroyed, essentially. So to begin with, we tried to use, we used it's not a formal boat, but it's like a boat basically to cross the river, because that was why there was a bridge, because we needed to cross the river to go from Mandalay to Sagaing. So at the very beginning, there was this boat, and then later on, the old bridge, the old road was being opened, and then the locations that was most hit in Myanmar by the earthquake, it's going through modernization, let's say, wherein there's like new roads, and it was these new roads that was heavily impacted. So what we did was we took, the old road, which yes, increased the travel time by a lot, but also it was fine because then it gave us access to the different population that we needed to access. So yeah, one of my, and that's just what we do in MSF. I think and we do have one of my favorite guideline in MSF. We have guidelines for everything, right? Because we're an emergency organizations, we don't really need to, we need to think, yes, but also when we're there, we need to be able to know what to do by having clear guidelines. And I think one of my very favorite guideline in MSF is how to build a road. We have this guideline because I was told in one of my very first emergency response, this was the Ebola outbreak of 2013 in West Africa, and I was told, if there's no road, build a road. Here is your guideline. And I was like, yeah, but I'm not a logistician. I'm a medical person. And then I was told, but you're an MSFer. You do what you can. So yeah, we do have a guideline for how to build a road. Thank you.
It seems like innovative MSF because you need to make your own road. This is a question from one of our audiences. You really emphasized mental health because of natural disaster. A lot of children, young people could be traumatized, and I think it's really important for them to recover from that. However, even amidst the recovery, there is news articles that share that there's still civil conflict, and it's even escalating during these recovery efforts. How is the safety of the humanitarian workers being ensured? You shared there's a guideline, and is there anything like a protocol around the mental health of the workers there?
Yeah, yes. So that is a very important question, and thank you for asking that question. Yes, is the short answer. The mental health, it's not just of our population, it's also of our teams, our staff, right? That's also important because we can only go so far if we're also feeling safe, if we also are confident we're able to deliver the care that we need to deliver. This is why yeah, I also mentioned before that as MSF, access is important for us, right? Where we're not gonna take risks if the costs are too high, right? And this includes ensuring, yeah, we have strict security guidelines, security policies. We have quite strict, risk analysis that goes in there. And then on the duty of care side as well for our staff, yes, absolutely. We have to ensure that trauma, secondary trauma, is being addressed for the safety of our staff, and that they are able to, that we in fact are able to provide the services that we need to be able to provide in a safe environment. So yes, these are very, very important for us as MSF. And after these interventions, or after being, for example, if you're being deployed in difficult situations in these types of contexts, we do have our staff health post deployment, where you get mental health counseling if you need it, debriefings, anything that you might need to be able to process through the experience that we've had, that you've seen, and all of these other things. So yes, very, very important, and thank you for asking that question. Thank you.
Ukraine, Syria, Gaza, Yemen are some of the areas that you have been active in, not only in conflict areas, but even long-term crises are part of your portfolio. What is the difference between these types of conflicts or crises and natural disasters?
Very good question. So the conflict, we have protracted conflict, very long term. So we are there as MSF having long-term missions. It just so happens as well that these locations are actually locations as well wherein natural disasters are increasing more and more now. So yeah, because when we say natural disasters, we're not just talking about typhoons. We're also talking about drought, heat waves, all of these things. We're in Sudan with the conflict in Sudan. In Ukraine with the conflict in Ukraine, all of these locations, we've been there long term, not just because of the conflict, but even before that, because of, in Sudan, I remember ages ago, there was a malnutrition crisis because of drought, which is also considered a natural disaster. In the Philippines, we're in the Philippines as well because of long term, not just because of not just because of Haiyan. I don't know if you guys remember Haiyan, the one of the biggest storms. But even before that, there was quite a bit of HIV, TB in the Philippines, so we were there because of that. And then it just so happens that it's one of the highest, it's one of the places with the highest incidence rate of typhoons, right? So MSF, we're not just in these locations, but basically MSF, we're in locations because we respond to conflict, man-made conflict, natural disasters, and as well to populations who are excluded from healthcare. So the biggest difference really is, for me, and this is a very personal answer, conflict is man-made, natural disaster not so much, right? But the impact to the population, much the same. It's just a little bit more frustrating for myself as a person to be in conflict contexts, which is my main context, because I know that it's man-made and it could be prevented, but it's just, yeah. We need to do more, essentially, when it comes to these conflicts as an international community in general. And I will leave it there because it's a different conversation. But yeah, that's mainly the main difference that I can say. Conflict, man-made, natural disaster, it happens. It's brought on by, it's exacerbated more now because of climate change, sure, which is again driven by people. But hey, regardless of what it is, if it's an emergency that causes increased suffering, death to population, we try our best to be there. Thank you.
Yes, hope these man-made disasters can, in the near future, be addressed. For our last question today, is something that we always ask during these focus sessions. We have a lot of people joining in from Korea. We have people who are not in Myanmar listening in. So we want to ask you, in these humanitarian aid fields, for those of us who are a step away from that, including myself, how can we help? For Myanmar, what are some of the methods that we can alleviate the difficulties in the region? What can we do to help out and support the situation?
Yeah, continue talking about it. continue talking about these different emergencies, these different vulnerable populations, these different needs that we have right in our backyards, right in our region. Continue talking about it in your different communities, in your workplaces, within your families, and talk about it in a sense wherein it's not so much just because you're not there, it doesn't mean that you're helpless and that you can't do anything. Talking about it and ensuring that we share and they're not forgotten. These needs are not forgotten. These populations are not forgotten. That's important. Keep being involved in these types of conversations, right? With MSF, with other humanitarian organizations as well in Korea that you have. If you can donate, sure, but really what's more important is having that conversation, keeping those conversations alive, so that then it doesn't get forgotten, right? And it keeps getting moved forward into the different mindset and societal mindset that we have and within our different societies. So yeah. Thank you. And keep asking these questions. Keep asking these questions. These are very, very important questions. And these are part of the conversations. So yeah, thank you.
Thank you, Jesah, so much for that. I know you have a very busy schedule. You will be coming to Korea in about 2 weeks. Thanks for taking the time out of your busy schedule to join the session today. And if you have any final words, just a quick goodbye for the people joining today in Korea.
Thank you very much for being here and being curious and having these conversations. And please keep up with it. And yeah, we'll see you guys soon, I hope. Take care.
Thank you very much, Jesah. Let's wrap up the session, everyone. As Jesah has mentioned, please keep us in mind, not just MSF, but all humanitarian aid efforts around the world. If you could keep us in your mind and talk about us, that would be of great help, and we hope we can depend on you for that. If you have any further questions about our efforts, Myanmar, or even our recruiting, please check out our homepage. Thank you so much for joining today. Hope you enjoy the rest of your evening. Thank you.